We have something very excited to talk about it for the holidays. Senior sex. What do you think about that? Stick around. Happy holidays.
Welcome to Senior Care Made Simple, an elder care podcast, your guide to navigating home health care with confidence. Hosted by Andrea Albertini, founder and CEO of Horizon Care Services, an industry leader in private duty home care in South Florida. To learn more, visit horizoncareservices.com.
Good morning, good afternoon, good evening. I am Andrea Albertini, your host for Senior Care Made Simple podcast. And today I am here again with my co-host, Doris Muscarella. Hi, Doris. How are you?
Hello. I'm very excited today. I love our guest. You're ready for a treat.
I know. I am so excited as well. And you guys are going to be very, very happy and intrigued, I'm sure.
It's a privilege to have Dr. Maureen Whelihan. I worked with her a couple of years ago. She is a board-certified OBGYN, one of the best in Palm Beach, Florida. She specializes in sexual health expert. Amazing. Doctor, without further ado, welcome to Senior Care Podcast.
So thanks for having me today. It's such an important topic. I love when everyone wants to talk about sex. It makes everyone smile.
That's for sure.
Just thinking about it. Even if you can't do it anymore.
I'm going to be your patient, Doc. I'll make an appointment next week.
We'll make it better.
So tell us a little bit about your background so the listeners know.
So I'm an OBGYN, so delivered babies, took care of GYN patients. But when I stopped doing obstetrics in 2002, my practice changed. The women that came in were pretty much 40 and over, and they had a whole new set of concerns. They were concerned about their hormones, vaginal dryness, painful sex. And with that, I always lived around, my practice was always around some senior communities. So currently I'm by the Fountains in Poinciana. So really popular senior communities. Wycliffe is a short distance away. And so I already have that demographic. And it was just very well known in the community that I was open to talking about sex. Now, in the beginning, I didn't have a lot of background or information to help the patients. So I joined an organization called the International Society for the Study of Women's Sexual Health. Yes, it exists.
Wow, that's awesome.
It's great research. They have a journal, the Journal of Sexual Medicine, for those who like to read up. And with that, it sort of developed my expertise. So the more things that I learned about that I could help patients, the better it was, because then my demographic of patient got bigger. And as you know, in Florida, we have a lot of seniors that are active. I had a patient this morning. She is 100. Oh, wow. It wasn't for sex, but she comes in with a cane but doesn't use it. And she was in for a problem, and she reminded me that she's 100.5. So with that, we have to recognize that sex changes between 40 and 100. And with that, we just have to adapt the conversation to fit whatever intimacy that couple is having, or single.
Very interesting, because I believe that after you turn 65, your health insurance doesn't cover you. Is that correct?
Well, not really. So if you go on Medicare, which is available to us at 65, Medicare stops paying for what would routinely be the well woman visit that everybody's used to. You come in, you get naked, breast, pelvic, and that's your exam. Medicare is more directed at come in for whatever problems you have. So, you have vaginal dryness or painful sex or a breast lump, or whatever, you can still come to the doctor. What's interesting is they don't pay for some of the screenings that would normally be paid for in someone on commercial insurance, like STD testing. Oh. What do they think those infections stop at 65? I can tell you for sure they don't. So the conversation that I have to have with my patient is, hey, listen, if you're sexually active and having partners periodically, different partners, some are actually in the lifestyle, which means they have multiple partners as a couple, they have sex with other couples, that some STD testing should be done annually. The other population that I think is the bigger conversation is, men over a certain age, let's say men over 50 for the most part, who are single and out having fun, they have a little harder time managing their erection when they have a condom on. So it's not as reliable. So they don't really want to wear a condom. But the single girl who is trying to be, think about herself says, there's got to be a solution. So my solution for that is STD testing. So I give a prescription to my patient with no name on it or date. And I'm like, well, fill in the name and date and have him go to the lab and get these tests. And then I'll get the answer and give you the all clear. So it does give you some temporary comfort, obviously not quite the same protection as a condom. So all these things come up that may or may not be related to insurance. But the good news is the tests aren't that expensive.
You wrote an article that said good sex after 70. I've read it twice. Can you talk a little bit about that one?
Well, patients come in and I always ask everyone, do you have any sexual concerns? Or sometimes if the vagina just looks really healthy, I'll say, well, it looks like you're having great sex. And they'll giggle like, how do you tell? Is there a sign down there? And I say your tissue looks like you're 40 and that means you're using it, which is great. And then I'll try and get them to tell me a story. And so having that conversation sort of opens it up. Sometimes the patients already know what I do and they come in and ask the question. So I felt like whenever I'm talking to people at a party, you can imagine my conversation is usually entertaining.
Yes, I can.
With a couple of drinks, that would be amazing.
Yeah, it usually doesn't take that. But, I'll say to them, everybody, first of all, we all know, I'm 64, so we all know that we still feel young. So I feel like I'm 40 most of the time, except when I'm getting out of bed in the morning, and I probably feel 64 then. But in our brain, we're still young, and why wouldn't we be having sex? Sometimes the patient will say, of course I am, dear.
I love that. That's the best.
And I'm like, oh, yeah, of course, I knew that. So I think that when kids thinking about their parents, do you know how many parents, women, worry that should they die, that when their kids come and clean out the house, that they're going to find the vibrator under the bed? So they have a friend who's younger and healthier and says, look, if I should go down, please go right to this area here and clear that out.
I never thought about that.
Oh, yeah. And so...
Listen, we had an episode about wills and estate. So
that's a good idea.
I don't think you need to will your vibrator to anybody because they're not really reusable.
No, we don't have to will. No, we're not going to put it on the power of attorney either.
Yeah. So, but you have that friend, and she's got to be healthier and younger, right, so that she can be alive and when you don't live. But I really take the approach of if your kids knew you had a nice vibrator or whatever you have. Right on. I think they would smile. So don't assume that your kids would be shocked at what you're doing because they're probably wishing that they were still doing it.
Exactly.
So in your article, you talk about the finding. There findings found that in the 70 to 78 age group, 53% of men and 44% of women were sexually active.
I think those numbers get better over time, right? Because there's more information out there. Even if their doctor is not asking them about it, they're able to AI it now and find out, how do I get a better vagina? When someone comes in over 70 and says, I've seen all your reviews. And I'm like, really? I never even knew about looking at reviews until a few years ago. And so patients are learning how to find the information they want, even if it's not from the doctor that they're talking to, which is great. But with that, there's a lot of sexual activity. Now, some patients will say, well, we don't have sex like the regular way. And I'm like, really? How do you do it? And they say, well, he can't really get an erection, so he stimulates me and I stimulate him. I said, oh, well, that's called mutual masturbation, and everyone does that. They're like, really? Like they think they have this little hidden secret that nobody is finding a different way to have sex when you can't have sex the old-fashioned way.
Correct.
Think about hip hip replacement. We know when you have a hip replacement, you can't bend quite the same way that you used to. So I try and teach patients, okay, so lay on the bed and, put your one foot here and your other foot on his chest, and he can stand up with that hip replacement. And, you just give them some ideas of different positions, because maybe for the last 40 years they've been doing missionary.
Right.
But the fact is that people love the closeness that happens when two people get together. They giggle, they think it's funny, even if things aren't working well, because they can always find a way to have satisfaction. And it's very interesting in that article, it really talked about, it was like 80% of women thought it was great sex and maybe 74% of men. And you were like, well, we always think that men are getting the better end of the deal. But the reasons for enjoyment were different. The men who were not as satisfied were judging the quality of their performance. Was their erection strong enough, or did it last long enough? That's not what women are worried about. Women love that she's pleasing her partner and that he's happy and she feels good. So understanding what satisfaction is and what qualifies a sexually satisfying encounter can be anything. And so just having that conversation in any age group, well into the 70s and 80s for sure.
Absolutely. Well, yeah, here it says that men were 71% satisfied, but women were 89% satisfied. Yeah. I love that. I read that. I'm like, yes, you go, girl.
I know. Because first of all, women, thankfully for our lifetime, are very easy to please, should we let them, right? So when women aren't having good sex, it's because they're saying no, but the women are saying, get on it. Come on. Yes. We don't have blood flow issues, Plavix and blood thinners aren't going to change the quality of the performance. Maybe a little bit more vibration with aging. Everything gets a little duller with age. So sometimes a little bit more vibration. But for the most part, women can keep going if you get on it the right way. So they're just happy that A, they're getting it, and B, that their partner loves what they're getting. And it really makes them feel close, because women are really having sex for security and really pleasing their partner.
So question for you. I'm here with the questions. You can jump in anytime you want.
Fine. I'm just listening to you guys.
She's got her mental recorder on going, I'm checking this.
I am just listening because
we're learning.
We're learning. I'm just listening. This is amazing. I will have all the Horizon Care Services couples that still marry, having fun in the next few years here.
Awesome.
With your help, Doc.
Awesome. So important. Hormones.
Yes.
Okay. In my culture, it's taboo. The hormones are going to give you cancer, breast cancer. Tell me about that.
So if anybody was following the news in the last 2 weeks ago or so, the FDA under Dr. McCary lifted that old boxed warning, what the news would call a black box warning, but the box warning that says, hey, danger, hormones are not good for you. They cause all these bad things. That's been lifted. And the reason that was, he went into the whole history on the YouTube interview, but basically his mother had osteoporosis, she had a fracture. All these things could have been prevented with hormone therapy and things that she just didn't know about or wasn't offered because her doctors thought it was taboo. So suffice it to say, if you follow the science and take low-dose hormone therapy, estrogen through your skin is the safest way, whether it's a patch or a gel, and then progesterone to protect the uterus. If you have a uterus, you can easily take low-dose hormone therapy for a long time. How long? That's up for discussion with your doctor, but certainly for 10 years to gain the cardiovascular benefits and so forth. But the number one reason why women don't have sex, especially at the menopausal transition and after, is because of pain. Such a silly thing to miss. And shame on the OBGYNs or doctors who are looking in that vagina that don't say, hey, this looks a little dry down here. Do you want to do something about it? No matter what, you surely can think of something to ask that patient about her dry looking vagina. instead of looking going, well, this looks all dried up. There's some cobwebs in here. So guess this isn't getting any use, right? So I always say, when women say they don't like sex, I say, do you not like sex, or do you not like sex because it hurts? And then it's both sometimes. Which came first? Because if it hurts, you're going to learn you hate sex. Yeah. So taking care of vaginal dryness is critical. And every OBGYN, even ones that don't like to talk about sex, which is most of them, know how to fix a dry vagina or one with pain. And if you take the traditional treatment, which should repair that vagina back to age 40 in 3 months, if you are not better, like a rock star in 3 months, then it's something else, and you need to see the next person. So whenever I'm starting somebody on traditional therapy for painful sex, I say, if you are not having painless intercourse in 3 months, I need to examine you again and figure out what else is going on. So there's lots of causes, but they all have a remedy. I had a lady yesterday, and she wanted to talk about painful sex. And her story went that she hadn't had intercourse in, so she was 69. She hadn't had intercourse in 4 years for a variety of reasons. And so she met somebody, or it was somebody she knew, but they decided they were going to try it out. And I guess he was offering something a bit sizable for her, and between her small vagina and his anaconda, it was pain. And she said it was actually bleeding. And I'm like, well, he could have torn the skin. She goes, well, that's exactly what it looked like. I made him get a magnifier because both of us have bad vision, and he had the magnifier down there to see what was going on. And she said, he says it looks like it has a cut. And I said, well, that's probably what happened, because it's like paper down there and it just didn't stretch. I said, the good news is I'm going to have this working well in 3 months. And she said, he doesn't live here. Okay, when do you see him next? She said, well, I'm going away for 3 weeks. I'm like, great start. So in 1 month, you're going to be better. And in 3 months, you'll be ready for the anaconda. And
that is hilarious.
And I love it.
Because then women worry about, maybe he's too big. And I'm like, I don't know that that's ever the case, but we'll make it adapt. So let's get the vagina willing to accept whatever you want to offer it. So just everyday stuff like that. But she didn't think to ask anybody about her dry vagina because she wasn't using it for the last 4 years.
But that's taboo among certain women. We don't talk about it. I mean, really, it's something that's a sore subject.
I know.
So a question about the hormones. Do the hormones trigger a menstrual cycle or anything like that? How does that work?
So let's talk about hormones in 2 different ways. We just talked a lot about painful sex. To treat painful sex, you use an estrogen vaginal cream, but it is not systemic, meaning it's local therapy. It doesn't get in your bloodstream. So I can use that same cream in women with estrogen-dependent cancers like breast cancer. In their usual doses, you can use estrogen cream and you're not considered to be taking hormones. Oh, right? Okay. Now, your question is more about systemic hormones. So if I start taking low-dose hormone therapy for hot flashes or libido or other things, am I going to get a period? And the answer is it shouldn't be that way. Now, you'll hear about pellet therapy out there. Pellet therapy is generally considered high-dose therapy, and there may be a higher chance of having some bleeding, but everything can be adjusted, so that's not to be expected.
Okay.
It's not the end of the world if it happens.
Right.
It needs some modifications, but my approach is always start low and go up so that we don't run into those things.
Hey, producer Chris here. Just wanted to say that Dr. Whelihan spoke for quite a while and spent a ton of time with Doris and Andrea. So much so that we are going to save some of her truly amazing stories for next week's episode. So be sure to tune in next week for part 2 of Sex at 70 with Dr. Whelihan. Senior Care Made Simple, an elder care podcast, has been brought to you by Horizon Care Services, your private duty choice in home care in South Florida. For more information on acquiring home care assistance, visit horizoncareservices.com.